It's worse than childbirth. It's worse than kidney stones. Pain that you would never want your worst enemy to experience. What the diary study did was to unleash an entire domain of listening to the patient's daily pain experience. The pain diary study rewrote sickle cell history. Seeking care for sickle cell disease in the United States is a social phenomenon because emergency rooms are crowded. If you're not having a heart attack, you're not going to be seen immediately. So you might be sitting there for hours on end, writhing in pain. By the time you actually get seen by a doctor and you get some opioids, which they're stingy with, you might be angry by that time that you're not believed, that you're undertreated, and that you had to wait so long. The pain of sickle cell disease is a window to all pain. We did this huge study. We studied 308 patients for 6 months. Every day, we asked them to fill out a diary. What we expected is that people were going to tell us they were in pain a few days out of the month, but mostly having zero pain. What we got back was a boatload of emotion. I'm sure glad you're listening to me. Nobody's ever listened to me before. The PiSCES study gave evidence of pain in sickle cell disease that revolutionized emergency department treatment ultimately. In fact, the PiSCES study defined acute pain and then chronic pain in sickle cell disease. We're using those definitions now to do controlled clinical trials of treatment. We're using those definitions, hopefully, to influence policy, like disability policy. What VCU has done is establish itself as, I will say, one of the top 5 sickle cell programs in the nation. Certainly one of the largest, certainly one of the best funded, and now I would say one of the most scientifically advanced. I feel like we're in a new place now with therapies. I feel like we're in a new place now with diagnosis. But we won't know what our patients need if we stop listening to them. God gave you 2 ears and 1 mouth. Use accordingly. Had I not come to VCU, I don't think I would be where I am today.